to Evans, in what ways does Kenya's debt situation impact its ability to achieve specific sustainable development goals, specifically around health, water, and maybe social protection? Yeah.
Thanks a lot. Again, Evans Kibet is my name, the coordinator, Rift Valley Budget Hub. First, I want to appreciate Cuba for bringing in some very, I would say, terrifying numbers. When you talk about 11 trillion, it's not pocket change, I think, and the economics that I think they do the analysis. If you look at it vis-a-vis our GDP, and maybe later I would wish him to comment. What does it mean when you say debt is about 68% of our GDP in the present value? Now to my question on how it affects service delivery, and especially the devolved units. I'll start with a statement that even His Excellency the President recently confessed, that devolution is a lifeline for many citizens. I think the people in the room, probably you must be coming from, I know when you talk about devolution, Nairobi, unfortunately Nairobi does not feature prominently, but I'm sure in our homes, there is something you would expect county governments to do. And that is defined in our Constitution of Kenya. Counties were created basically with the objective of improving livelihoods. If we forget about anything, devolution was supposed to improve livelihoods. Over and above, of course, through creating structures that are accountable, ensuring resources are devolved, and so on and so forth. But let's go practical. Water, for example, SDG number 3. Number 6, sorry, health is number 3. Number 6, what would it take counties to improve water access? For example, in West Pokot County, one of the counties that we really build capacity of citizens, from the current 38%, and they are talking about, because this is official numbers from the KDHS, the Kenya Demographic and Health Survey, that only 38% of the population have access to basic drinking water service today in this current age. The question is, what would it take to turn around that to the commitment that we have ratified of having universal access to water? I think your guess is as good as mine. We need a lot of resources to do that. When you come to health, I am very passionate about maternal health. SDG, one of the targets is to improve, reduce mortality rate to below 70 in every 100,000 births. And we're talking about a county like Baringo, where they have a baseline of around 345, you know. So a lot of investment needs to go to change this. And every financial year, citizens participate in the budget forums. I hope we are here. I am one of them. I go. And there is a lot of hope and expectation of county governments to change this situation. If you look at the budget documents, especially for the region I come from, the number of projects and programs that citizens expect in the water and health sector is actually huge. And I know my colleague panelists will talk about the situation even in Makueni, but the amount of resources available. So the question of amount of resources available to do this is a factor of how much revenue we are raising and what are we prioritizing. I think Cuba has talked about, and all of us know in the room, that if you are faced with a decision whether to repay debt, and I don't know whether that's a decision, or finance counties effectively and efficiently, I know it's not even debatable. We'll start first with what? With the debt, you know? So, and that leaves, you know, the hope of efficient service delivery fades away. Because if you look at even the last, the ambassador painted a very good picture, but I want to turn it a little bit around. If you look at what has changed, we have seen an improvement, but you know, getting from 38% water access, basic water access, to 100%, I think it's a very long way to go. In fact, in 7 years, it's almost impossible. But then, how did we get here? We have county governments who have functions, but then these functions are not well financed. One of the reasons, and is why we are discussing here, is public debt. Leave alone the amount of money, because that is, of course, decided at the level of division of revenue. Currently, in the current financial year, we are talking about counties receiving 385 billion. And if you go back to the costing of the function, I was doing an info pack for my county around ACD education, and I realized that they need over $1 billion just to sustain 2 ECD teachers in all the we have around 1,200 ECD centers in our country, just 2, and that's not the maximum standard required. You know, I think the educationists know here. And we have not talked about learning materials, we have not talked about feeding program, we have not talked about, but because of the limitation of resources, they end up allocating maximum of 400 million, since it has never gone beyond 400 million. So what happens? The problem of ineffective service delivery persists. The other question is, when does this money even come? You know, and I have, I don't know, and I hope the audience will ask. This will ask Cuba many questions. This 11 trillion, because before you kama kuna kitu inakufinya, you should understand it. Hii 11 trillion, what is the portfolio? Ni nani, who are we owing? How much? What are the conditions? So that we don't get surprised. I think lately, like this year, I am one of the people, and I am a practitioner, that I got shocked that one of our serious debt was coming due. You know, and I would want also my colleague panelists to comment on what did it mean for disbursement to counties. So you go to public participation, and you have highlighted or even earmarked several projects and programs to improve access to healthcare, access to water, social protection, the transfers to persons with disabilities, you know, and all that. But money comes in. In fact, our budget credibility research has shown that counties received less than 40% in the first half of the year. Even in this current financial year, and JK and Cuba will confirm the numbers, I checked the quarterly economic and budget review by Treasury. The official numbers say that they had disbursed 141 billion to counties, and I gave you the other number of 385. You can do your math. What percentage is that? It's close to 36. It's hardly 50%. It's just around 36 thereabout. And the citizens are waiting for water to come from their taps, and the health facilities that have been constructed to be equipped, you know. So we end up having the problem of rollovers, not being able to deliver, and of course and that also breeds citizen apathy. So I think the first question that I would want maybe and encourage us is to discuss this and see, and I like the rallying call to tuonge kuhusu debt and how it is affecting us. And if you think it's not affecting you, maybe start reflecting. I know, even if you are in an urban center, probably you have kids who depend on the dispensary for drugs, medicine and all that, you know. And a county like my county did a quantification exercise of, they needed around 700 million to deliver medical drugs and commodities annually. But because of this limitation of resources, they are only able to allocate around 150. And that explains why Hakuna Dawa has become synonymous with some of our public health facilities that are run by county governments. I hope I've brought the picture a bit closer home, away from the 11 trillion. Yeah.